You'll find 81-year-old Sung Tian-Ki here every Tuesday, coaching young children badminton. Nothing has stopped him picking up the racket at least once a week, not even cancer. Mr. Sung was diagnosed with stage 4 prostate cancer more than 10 years ago. But even as he underwent radiotherapy over a period of some 3 years, he continued playing his favorite sport. And it's this steely determination that gave him the will to fight the disease.
They took the cancer cell, went and do a biopsy. He came back, he looked at me, "Uncle, very aggressive cancer." So I said, "Doc, you have to continue to do what you want to do. Operate me or whatever. I'm not going out and come back." So he said, "Don't you want to discuss with family?" I said, "No, I will decide. Because if I discuss, I still have to come back. Give me the paper to sign before I start. Can I finish my therapy? In the afternoon, I want to go and play my badminton." He said, "Can. Can I go and eat some of my rubbish food like mee siam, lontong, which I love the most?" He said, "Can, but not too much. But when you play, you have to be slow because of the operation." I said, "Okay," I slowed down. So I went through every day, Monday to Friday, Monday about 37 rounds. And after that, my PSA was fantastic. Everything was normal.
Mr. Sung says battling and surviving the cancer gave his life new meaning. Less than a year after he learnt he had cancer, fame found this grandfather of 4. He won the Grandparent of the Year award in 2006, supported by the former Ministry of Community Development, Youth and Sport. He's also become more active in the community, learning to play the ukulele and performing at hospitals and old folks' homes. He even joined the Scout Association for seniors and volunteers regularly. Strong family bonds keep his spirits high too.
And I told my grandchildren, I said, "Your grandpa is going to fight and going to stay alive until all of you graduate." Dr. Henry Ho, when he operated me, he promised me in 2005, 10 years life. So come to now, I still see him. I say, "Hey, Doc, 10 years up already. I'm looking ahead for my granddaughter to get married. And my second grandson finished at NS, he's going overseas, waiting for his graduate. So that will all take about 5-6 years. By the time I'm 86, 87, I don't know."
According to the United Nations, the number of people aged 65 and above is expected to increase by 314% in Asia, reaching 857 million in 2050. With age being the greatest risk factor for developing cancer, geriatric oncology is a growing area in healthcare. Geriatric oncology, or the diagnosis and treatment of cancer in the elderly, is still a relatively new branch of medicine in Southeast Asia. But with an increasingly aging population in this region, cancer rates amongst the aged has grown significantly. In Singapore, for instance, about 60% of all new cases occur in patients aged 65 or older. Age, though, doesn't decrease the chances of survival. Much depends on the individual's health status and social support. And at the National Cancer Centre in Singapore, each patient's assessed so their treatment can be tailored.
We have studies that shows that in elderly patients, they do benefit from treatment just as well as our younger patients do. But it's all a matter of selecting who are these patients who are going to benefit from treatment and are less likely to suffer toxicities. These older patients tend to have a lot of other problems, medical problems, comorbidities. They tend to be on several different types of medications, and they might be a little more frail. For example, we evaluate how their memory is like, how their cognition is like. We might want to also take into account what their social setup is like, their social situation. And using all of these factors, we put it in together with what the patient's goals and their wishes are for their treatment.
Early detection is important for successful treatment and improves the chances of survival. In many cases, Dr. Tan says her patients know instinctively that something isn't right.
They might be losing lots and lots of weight, for example, and they can't explain why they've been losing weight. Their appetite might be poorer, or they might just be getting weaker and they can't explain it. Oftentimes we do have patients who do present because they have felt a lump certain parts of their body which hasn't gone away and has gotten worse, or it's causing them pain, or it's starting to bleed. What is important is to increase awareness amongst people of cancer and the symptoms, so that if they do have these symptoms, that they seek help early, as opposed to leaving it too late, where maybe even treatment options then might be limited. The earlier we pick up the cancer, the better the chances are that we're going to be able to offer effective treatment to be able to help these patients.
Keeping fit, active and optimistic helps to speed up recovery. The community also plays a crucial role.
What we need to do is, definitely create more awareness of how we treat our older patients, not just in the community, but also within our medical community as well. We would like to see an improvement in services that are out in the community. There are already fantastic services that are out in the community that's helping to support all these older patients, but ideally if we could, keep them out in the community as long as possible, away from having to be hospitalized and being in an institution. I would like to see that happen.
And that's exactly what Mr. Sing's doing. You'll find him out and about most days, doing what he loves.
Well, the next song I'm giving you is about life. In life, we have ups and downs. So whatever it is, we must fight and to go on. This is a song about don't give up a fight in Hokkien. So here it is. จิตสีสีจิตแม้นวานทานจิตสีโลแม่นต้านทานนากงสีกีบังกุยดีช่วยบัง